Hello everyone, welcome to Fitfolio, a channel for awesome facts and information. In today's video, we will be talking about top 10 common lung disease. Watch this video till the end for a better understanding and be sure to like, comment, and subscribe. Lung disorders comprise a wide range of ailments that impact the respiratory system, affecting its proper functioning. Numerous causes, such as smoking, genetic predispositions, exposure to environmental toxins or infections, can lead to lung illnesses. Chest pain, wheezing, shortness of breath, and prolonged coughing are common symptoms. Medication, lifestyle adjustments, and in extreme situations, procedures like oxygen therapy or surgery are among possible treatment approaches. Considering how essential the respiratory system is to life support, treating lung illnesses is essential to improving general health and quality of life. 1. Disease, COPD. The long-term inflammatory lung condition known as chronic obstructive pulmonary disease, COPD, results in restricted lung airflow. Breathing problems, coughing up mucus, sputum, and wheezing are among the symptoms. Long-term exposure to irritating chemicals or particulate matter, most frequently from cigarette smoke, is usually the cause of it. Heart disease, lung cancer, and a host of other ailments are more likely to strike those with COPD. 2. Asthma. A chronic lung condition that affects people of all ages is asthma. Breathing becomes more difficult due to inflammation and tightness in the muscles around the airways. Coughing, wheezing, shortness of breath, and tightness in the chest are some of the symptoms. Over time, these symptoms may become more or less severe. With the appropriate care, asthma may be controlled even though it can be a dangerous illness. Individuals experiencing asthmatic symptoms have to consult a medical practitioner. 3. Lung cancer. One kind of cancer that starts in the lungs is lung cancer. The two spiny organs in your chest that are your lungs are responsible for breathing in oxygen and exhaling carbon dioxide. Globally, lung cancer is the primary cause of cancer-related fatalities. The chance of developing lung cancer is highest among smokers, yet non-smokers can still develop the disease. The longer and more cigarettes you've smoked, the higher your chance of developing lung cancer. Even if you've smoked for a long time, you can drastically lower your risk of lung cancer if you give up. 4. Pneumonia. An infection known as pneumonia causes inflammation in one or both of the lungs' air sacs. The air sacs may fill with fluid or pus, purulent material, which can result in fever, chills, coughing up phlegm or pus, and trouble breathing. Pneumonia may be caused by a wide range of organisms, such as fungus, viruses, and bacteria. The severity of pneumonia can vary from minor to fatal. The most vulnerable groups are those under the age of 5, those over 65, those with compromised immune systems, and those in poor health. 5. Interstitial lung disease, ILD. A collection of illnesses together referred to as interstitial lung disease, ILD, result in lung inflammation and scarring. A dry cough and shortness of breath are signs of ILD. Medication, radiation therapy, connective tissue disorders, and hazardous material inhalation can all result in ILD. ILD frequently results in irreparable lung damage. 6. Pulmonary hypertension. Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. In one form of pulmonary hypertension, called pulmonary arterial hypertension, blood vessels in the lungs are narrowed, blocked, or destroyed. The damage slows blood flow through the lungs. Blood pressure in the lung arteries goes up. The heart must work harder to pump blood through the lungs. The extra effort eventually causes the heart muscle to become weak and fail. 7. Bronchitis. When the tubes that transport air into and out of your lungs are damaged, they might expand, become loose, and get scared. This disease is known as bronchitis. We refer to these tubes as airways. Although the exact etiology of bronchitis is unknown, infections or other conditions that damage the walls of your airways or prevent them from removing mucus buildup are often the cause of bronchitis. 8. Tuberculosis, TB. A dangerous disease that mostly affects the lungs is tuberculosis, TB. One group of bacteria is responsible for TB. When a person with tuberculosis coughs, sneezes, or sings, the disease can spread. This may release minute amounts of the germs into the atmosphere. The bacteria can then enter the lungs of another individual who inhales the droplets. Wherever individuals congregate in large groups or live in close quarters, tuberculosis is prone to spreading. Individuals with compromised immune systems, such as those living with HIV/AIDS, are more susceptible to TB than healthy individuals. Antibiotic medications are used to treat TB. However, some of the bacterial strains are becoming resistant to antibiotics. 9. Cystic fibrosis. The lungs, digestive system, and other organs of the body suffer significant damage from the hereditary condition known as cystic fibrosis. The cells that make mucus, perspiration, and digestive fluids are impacted by cystic fibrosis. Usually, these produced fluids are flimsy and thin. However, a faulty gene makes secretions thick and sticky in CF patients. Particularly in the lungs and pancreas, the secretions clog tubes, ducts, and passageways rather than serving as lubricants. 10. Pulmonary fibrosis. A lung condition known as pulmonary fibrosis is brought on by damaged and scarred lung tissue. The thicker, more rigid tissue impedes the normal functioning of your lungs. Breathlessness gets worse when your pulmonary fibrosis gets worse. There are several potential causes of the scarring linked to pulmonary fibrosis. However, physicians are typically unable to identify the exact cause of the issue. The illness is referred to as idiopathic pulmonary fibrosis when a cause is not established. This is our list of top 10 common lung disease. What do you think about our video? Please let us know in the comments area below. If you enjoyed this video and would want to hear from us again, please subscribe for more self-help videos and turn on the notification before leaving. Thank you for watching Fitfolio.